Hi, I'm Henry Chung, and I'm the medical director for the Big White Wall. Really happy to be here today with you. Big White Wall was started in 2009 by Jen Hyatt, who is our CEO. Jen Hyatt is a social entrepreneur, and the reason why she started the company was because she looked around and recognized that people were really having difficulty getting access to mental health treatment in the United Kingdom. And when she looked around, she noticed that there was lots of evidence for peer support communities and peers helping one another, but really no digital application that would support that, thus the mission of Big White Wall. The major problem I think Big White Wall was trying to solve was that there was too long a wait to receive formal mental health care. Secondly, there was broad awareness that many folks who were struggling with conditions, whether diagnosed or not diagnosed, were really not getting good advice or good support. Therefore, in beginning the Big White Wall, it really was just about peers coming together, sharing problems, sharing ideas, and figuring out how to help one another. Over time, what happened was that more folks were coming in with diagnosable disorders, depression, anxiety, and Jen realized that she needed to get more of an evidence-based inserted into the platform. And so over time, the population and membership of Big White Wall grew from people who were just suffering from the regular stresses of everyday living, all the way to people with severe mental disorders. The types of settings that it works in, it works really in primary care settings, it works in employer settings, it works really anywhere because it's a 24/7 platform that's available for patients to log on to anytime. What patients do or members do when they log on is they actually get a registration page, and they can first create an anonymous identity. Anonymity is actually core to the Big White Wall philosophy because it is through anonymity that members really express themselves honestly and truthfully. As they register, they talk about their concerns, a bit about what they're interested in, and then suggestions are built for their member page with tips on what they ought to do to help themselves, as well as taking various tests and assessments that will give them some idea about whether they should seek professional help or not seek professional help. The value created by this platform is actually quite large, and it fits into multiple domains. The first domain is that members get access to help, and they control their own journey. They can decide whether the self-help resources are enough for them, or whether they want to engage more with community members to get help and advice, or they can decide whether they want to take a course that's actually embedded in the wall that is very evidence-based, all the way to actually getting live therapy with a therapist. Now, one very important aspect of this anonymity I want to share is that we use wall guides who are professionally trained moderators to moderate all the content that is seen on the wall. It's important that folks are anonymous as well as feeling safe to express themselves.